everyone. We are so excited today to be hosting Conny Fraser from the Baby Grow Clinic. She's a registered nurse and the clinic is in Oranjezicht in the Western Cape in Cape Town. And with that, we're going to hand over to you straight away for a bit of an introduction.
Hello. How are you?
Good, and you?
Good. So do you want me to just introduce myself?
Yeah, so we're just going to look at sort of giving you context, like where you fit in, and then I'll go into how you got into this.
Yeah, so basically I'm a registered nurse and I run a baby clinic in Oranjezicht and one day a week I'm in Hot Bay. And I basically oversee a whole lot of babies in the city bowl and on that side and just advise mothers and help them along their journey, basically.
Amazing. And what led you to become involved in baby nursing and wellness specifically? How did you get into this?
So I always wanted to be a nurse. Well, I always wanted to work with people. And so I landed up getting into nursing, which I loved. And then as part of the training, you do your pediatric nursing and you do the clinic side of things. But when I finished nursing, I went into surgical adults, ICU, high care. So it was totally, completely opposite to baby world. And
I was
then
just
like
going
a
to
lot,
say,
yeah, no, no, totally. And then, like a lot of mothers, when you have a baby, you start looking at going into things that are related to babies and and children and parenting stuff. So, when I had a baby, I knew I didn't want to go back into the ICU high stress environment, but I wasn't sure what I wanted to do. And then, my own clinic that I was taking my baby to, the clinic sister got quite sick. And she was running a small clinic twice a week, and she said to me, "Would I mind helping out?" So I said, "Sure." My baby was 8 months old. He's now 19 years old, so that was a long time ago. And then I started helping up twice a week, and then she got really quite sick and she couldn't take on the clinic anymore. And
okay,
so that's how I kind of went into it. And now it's a much bigger clinic. We run 5 days a week, and yeah, so it's a whole different, but that's kind of how I landed in it. And I love it.
yes,
Yeah.
amazing. It's such an organic sort of change,
Yeah, but it kind of fits because it was all medical. It kind of all led into the other, so it
Yeah,
was good.
exactly. Um, okay, so I've got a really good question here. What are the main differences between a ped and a clinic, and how do you know when to use each one?
Okay. So a ped is a doctor, a clinic is a clinic sister. So we are
Yes.
obviously that's like a main difference. I would say the clinic is sort of your hub that you go to for everything. So it's your person that's going to help you branch wherever you need to go. So we see the babies much more frequently. We're also a well baby clinic. So we look at well babies and we obviously deal with some normal baby issues. Whereas a ped will look at what's going wrong with the baby, but they also do routine checks. So they'll do maybe at 6 weeks, 6 months, and 1 year, and we'll see you in between for all the other things. And we work very closely together. So all the peds know the clinic sisters and the clinic sisters know the peds, and we often WhatsApp each other about a specific client, what's going on. So that's main, and the main difference in our country, not so much overseas, is that in our country the clinic sisters vaccinate and the peds don't.
Yes.
So so generally that is quite a difference as well.
Okay, perfect. Um, Describe the common checks that you do during a baby consultation and why each one is so important.
So basically you'll have your baby. And what's important for your clinic sister is that they weigh your baby at birth and then they weigh your baby at discharge because those weights are quite different. So when you've had a normal vertex delivery, you'll stay in hospital for 2 days. After a Caesar, you'll be there for 3 days. And then they'll do a discharge weight. That is the weight us clinic sisters need to work from. So we'll see you within 7 to 10 days. And then you'll come in and we obviously do a little bit of admin, baby's name, surname, weights, all of that. And then we go, the first question I always ask is, how is the feeding? Because that's often the first
Yes.
issue or first activity you need to do with the baby. So we look at the feeding first, what milk are you on, how much milk, etc., etc. Then we'll do a head to toe check. Well, this is what I normally do. I do a head to toe check. So I'll check like cradle cap, eyes, jaundice, are they gunky? We'll check tongues for tongue ties, thrush. We go down, we look at the skin, is there any eczema? And we just do a little head to toe check. Then we'll do a weight check. And then we'll take it from there. Anything the moms are worried about, then I check in on the parents. I quietly observe the parents together and all of that. So that's generally my head to toe check.
Yes. And obviously, like you said, checking up on the mom, because
Mm.
sometimes it can be quite, that stage is very overwhelming.
Sometimes, I would say most times,
Most,
it's very overwhelming.
very.
Very overwhelming.
Yeah.
Yeah.
And I think again, you don't sort of open your mouth and say, I'm not coping because you're determined to, yeah.
And you know what? I would say honestly, 80% of mothers struggle, especially with your first baby. It is super hard. We don't know what we're doing. So it's tough.
Exactly. Um, okay, perfect. So, having said all of this, what are some common newborn issues that your clinic can assist moms with?
I'd say the first, probably most common issue is breastfeeding. So getting the latch right. So what I'll do is I'll do the basics. So I'll check your latch, sometimes something I can tweak and then it works out. Otherwise, I'll refer them to a breastfeeding consultant. And this is their entire job to just deal with those kind of issues. And then they'll spend an hour with the breastfeeding consultant and get that right. So we often look at feeding. Those are the common issues in the beginning. The next one I would say would be a fussy, crampy, colicky baby. That's another sort of common issue. And then anything, fevers, blocked tear ducts, babies screaming all the time. There are lots of different issues that crop up as we go. But I would say in the beginning, those are the main two, fussy and feeding.
Mm.
Yeah.
And then, obviously, as you go along, maybe like tummy issues, sleeping.
Sleeping is
Yeah.
always an issue. Not so much in the beginning. As tiring as it is, we know we need to feed them every 3 hours, so we know
Yes.
we're going to get up. But as it becomes more relentless, that sleep deprivation, and so we start dealing with sleep a lot more as they get a bit older. And solids and, separation anxiety, there's lots of things.
Yes. There's lots of things.
There's
We could
lots.
go
We can
into a
talk for
whole.
days. Teenagers, there's tons.
um. Okay. So, if you were chatting to a mom that had just given birth, what are some great post-birthing recovery tips, in your opinion?
I would say, I would say this to parents. You need to hunker down with your baby. And I have some moms running businesses that are on the email within 3 days. If you can have the luxury of absolutely not working for a while, you need to cling on to that because we are so hard on ourselves. We do everything else, but really, the best tip I can give you is just focus on you and the baby. It's a massive job in itself. It's something you've never
Yes.
done before. I'm always going to talk as a first baby scenario. So that would be my first tip. Try not to do anything else but the baby.
Mm.
Try and for the first 2 weeks, just the three of you, your partner, and your baby, just get to know each other. And the next step after that is learn to be free with your baby. I find moms often get very anxious. They don't want to leave the house. They don't want to do much. But you know what? In order to get over that mental anxiety hurdle that you can have, it's good to learn how to get back into your normal life.
Yeah.
And it's important to be able to just get free with your baby. So go for walks on the proms, get out, go for a cup of coffee, etc., etc. So I definitely would encourage that. That's why I don't do home visits anymore. I want the moms to come to clinic. I want them to put the baby in the car
Mm.
seat, get in a car, come to the clinic, get dressed, have a shower, get out. It's
It's
important to get
true.
out there.
Yeah.
That's the
Because
first thing.
otherwise, you just,
Yeah,
yeah. You're in
yeah.
your
Otherwise,
jammies the whole time and you stay like
correct.
that, and then you don't even know how many days have passed. And it's like,
Correct, correct. It's a whole thing. And then I always recommend your diet because moms are notorious for eating toast and cheese because they're on the go. They don't really have time. So if you can, eat a balanced diet or get your partner to bring some healthy food in. You can get lots of different food delivery options now. So eat well,
yes,
take your multivites, drink lots of fluid, especially if you're breastfeeding. I want to say sleep and rest well, but we know that's not really going to happen. So try and focus on everything else.
yes, exactly.
Mm.
Maybe like organize a support system a bit so that you can have a little nap here and
Absolutely.
there.
Yeah. If you can get mums involved, grannies and things, brilliant.
Grannies, moms, aunts, the
Yeah,
whole the
anybody,
whole toot.
anybody. But I find with mothers, they sometimes don't want other people to be involved. So
That was
it's
me.
very mom dependent. Yeah, it's that mammal instinct. You don't think anyone else can do it right, so you don't really want. So if
Exactly.
that's how you are, then focus on all the other little things so that you're well enough to, look after your baby.
Yes, exactly. Um, okay, so I know this is quite a
I
touchy
know.
subject, yes. So I was actually a little bit nervous about, but I'm on a few mom groups and sometimes I see these questions and I actually have to stay off because I just, this is too much. But what are your thoughts on vaccination?
Am I allowed to ask you that? Because I don't know where you are on the vaccination.
No, I'll answer. So I think there's confusion between I understand where it's coming from, but the stuff that happened during COVID and the things that babies are immunized against, like my child has had all of her vaccinations. She had terrible, terrible reactions compared to her cousins. So she wouldn't eat for 2 weeks. She'd vomit. She'd have an upset stomach. She'd cry and cry. It was like a disaster every time, but we did it.
Hmm.
I think it's important. But there's this huge fear now because there were so many complicated deaths from COVID. And the thing is that these vaccinations were researched and trialed for like years and years and years and years and years. COVID, we didn't have the time.
Mm.
So I can understand that maybe there were more issues with that and people had underlying issues and, it was a mess. But it's getting all wrapped up in the same, uh,
Do you
yeah.
know what? I am obviously a vaccinator. I vaccinate my kids. It's what I do for a living. So I am a firm believer in vaccines. I think it's probably the best medical invention we've had at combating diseases. So I feel like it's definitely a place, but I also am pro-choice. So now I'm going to be
Yes.
controversial. I'm going to be controversial here because the other clinic sisters are going to be upset with me. But I will listen to whatever a mom wants to do. And I feel like this about everything in the clinic, not just vaccines. So I really try and create a non-judgmental environment. So I will educate the mothers, I'll explain the diseases, I'll give them pamphlets.
Yes.
And you know what? If you want to tailor something, we can do that. But to be honest, I don't see a lot of non-vaccinators in the clinic because that's what most people come for as well, is vaccines. So
Yes,
if you're not
exactly.
vaccinating, I'm probably not going to see you in the clinic. So I am pro-choice. I will be open to whatever parents want to do. I'll try and educate as much as I can. But of course, I am pro-vaccines because it's what I do. So, and I'm from a medical background, so that's kind of where I'm at.
Yes.
I'll move
No,
on from that topic
absolutely.
because you're going to get lots of.
Yes. No, no, no. And also, I agree with you. At the end of the day, it is your child. And if that's your stance, then yeah. Okay. Can you assist a mom with choosing a birthing plan? Because this can also be quite a controversial bit of a.
What do you mean, a birth plan for when they give birth? Like
Yes,
a.
because I had a cesarean. I had a medical reason, but if I tell most people, they're like, oh, you had there's that. I get so angry, but I can understand where it comes from. But it's very frustrating
Mm,
because sometimes we actually have reasons.
yeah, yeah, yeah. 100%.
Yeah.
So a birth plan for me is more about, so when you set out to have a baby, it's more about the natural delivery because a birth plan, you can have a birth plan for a Caesar, but it's obviously going to be a bit more complicated for a natural delivery. So you'll set that out. For me, it's more a mental program of where you would like, it's like a manifestation of where you would like your birth to go.
Yes.
So
Yes.
if you first want to start with gas and air, and then you want to have uh, a hot bath, and then you're going to have an epidural. So you'll have your layers that you want to go through before, if need be. But I will say to moms, get your birth plan. It's like a manifestation. You're going to set your road out ahead of you. but be open to things changing if they need to change.
Exactly.
That's what I would say about a birth plan because things can change and every birth has a story. There are very few births that are just cut dry, 3.5, 4, 5, 6 hours,
Simple.
beautiful, natural, no episiotomy in a very few really go like that. And if you had that, amazing, you're probably going to struggle with breastfeeding. Nothing's going to be completely easy. So be open to things changing, but I definitely would set something out for yourself. Why not? You might as well try everything.
Exactly.
Yeah.
It's such a beautiful thing, but also it's not really in your control. There's so many different varying factors. So just to
So
like
many.
breathe into it. Yeah. Okay,
Relax into going
great.
with the flow, I would say.
Yes, exactly. Even if it's like against your natural state, it's the best mental space to be in. Yeah.
Mm, exactly.
Okay, so in your opinion, what are the biggest challenges that new moms struggle with in terms of getting breastfeeding right, and how can we combat them?
So sometimes you will start breastfeeding and it just flows and it's easy, but it's always a little bit sore in the beginning. Even if your breastfeeding latch is perfect, everything's amazing, it's going to be a little bit of a challenge because you've got to work through
Yeah,
that. So that's like the normal road. Sometimes it's extremely painful. You can't get the latch right. So the first thing I would say to moms is get a breastfeeding consultant on board quickly. So the best thing to do is start breastfeeding in the first hour. If you already know, okay, no, I don't know what I'm doing here, I'm struggling, get a breastfeeding consultant on board because they are really going to help that journey so much. That's the first thing. Secondly, I would say get to know your breasts. Once a day, stand in front of the mirrors and really feel your breasts. If there's one hard red lump, or if they feel very hard everywhere, or the milk's not flowing as what it was before on the one side than the other, you might have a blocked duct. Do I have a fever or chills? Do I have a temp? Those kind of things. Just learn to know your breasts and make sure that they're nice and soft at the end of every day. Because the sooner you deal with any issues that crop up, the
nip
better we
it in
can
the bud.
resolve them. Yeah, nip
Yeah,
it in the bud because
exactly.
things move quickly in the boob. So you'll have a blocked duct that becomes a mastitis, then can potentially lead to an abscess if you just leave it. So you want to get in quickly with those kind of things.
Yeah, before it becomes. I had mastitis once, and it was incredibly. I mean, I saw stars when they were trying to
I mean,
work it
you know
out.
what?
It was like I was in space.
People downplay mastitis because it's
Oh
quite
my
common.
goodness.
They downplay
Hmm.
it because you almost feel like you're dying. I know it sounds terrible, but you like because
It is
when an adult gets a temperature, you feel terrible. It's not like when a
terrible.
baby gets a temperature or a kid gets a temperature. You really feel shivery, wet, sweaty, like you got malaria or something.
Awful.
It's like a horrible feeling. And when you get mastitis, you get a temperature and you need to clear that duct and you probably need antibiotics. So just be aware, do your research,
Yeah.
yeah.
Also, I found that wearing your 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 bras, it's very important, like not to wear underwires or anything
Mm-hmm.
that's cutting anything
Yeah.
to allow it to like flow.
Definitely, but also you can get it when you just say your baby slept for 6 hours and you're just sleeping on the and you're sleeping and you've slept on that boob for like 5 hours and it's been blocked. Even then it can kick off. So it might be something that you're not even doing wrong, but it can happen. It just can happen.
Or just think about it now, and I'm like, oh, I feel a pain.
Horrible. That's terrible. That's terrible. Shame.
Shame. Okay, perfect. So we see the clinic assists with the transition to solids, which it can be extremely daunting. Oh my goodness. How do you help make this transition less daunting for both mom and baby?
So the transition to solids feels like a whole new, I want to say adult phase because you're breastfeeding, you're dealing with baby stuff, baby stuff, baby stuff. And then suddenly you blink and you're at 4 or 5 months and now we got to eat food, like proper food. It's like a whole big jump into the next level. And it's a layer of work. You got to cook, you got to do things.
Yeah, it's a whole different.
Yeah. So I normally will see them just before, say, 4.5, 5 months, just for a solids weight check-in. We dedicate that whole consult to solids because I've learned over the 19 years that mothers actually want Tell me exactly what to do, when to do it, what time, how much. That's what they want. And I know this. So I will say you need to do 1 teaspoon of butternut at 5 o'clock in the evening. Don't add anything, just steam or boil it puree, and you feed it with a baby teaspoon, and so we go. And we just go step by step by step. I find that works the best with moms because, and I don't give them like 3 months. I give you 4 weeks, I'm going to see you again. We're going to do another 4 weeks, and I'm going to see you again. So then we just go step by step. That's the first thing. The second thing I want to say about solids is it's very loose. I might start at 5 in the evening. The PED might suggest you start at 1 in the day. A book might suggest you start mid-morning. It doesn't really matter. You can't really get it wrong. So none of it is wrong. So if you can remember in your mind, just keep it loose. We're trying different things. You can try a bit of Avo on the go. It's not like it has to be so strict. But I also know that moms do want a bit of a routine.
That's the thing, and the reason why I actually bring it up is because I messed it up so badly. I'm quite like a OCD regiment, like A type. I wanted everything perfect, and my daughter was just not into eating solid, so it took
But I
forever
don't
for
know.
her.
Do you think you messed it up, or do you think that was just her?
No,
Like
I took her. We ended up. I mean, she refused solids until she was 15 months. 15. And it was because I'd approached it completely. We ended up going to a specialist a few times, a food play, that kind of thing, because I don't like mess and I'd freak out. And obviously, you meant to let the baby,
Mm.
looking back, I'm like, what was wrong with me that I couldn't put her needs ahead of mine? But we were in the middle of COVID and I was already like not.
Yeah, yeah, no, no,
So
it's tough.
looking back, huge regret. But
Mm.
yes, just allowing baby to it's play, like
It is play, but what I'd also
sensory.
say for a mom like that, because there are a few moms like that who don't like the mess, and there's going to be mess with solids, is instead of putting like 10 things in front of them, put 3 things in front of them. Because inevitably in the beginning, they're just going to pick it up and throw it over the side anyway.
Exactly.
So
And I learned right at the end, I had this like huge picnic plastic tablecloth thing that I put under her, and then it wasn't a problem. But I only found that out too late. So we were already like, yeah.
And the second tip to prevent a picky baby is as many flavors as you can get in high variety in the beginning. So we're very set in what we eat. You buy your certain foods, and that's what you eat. But you got to almost think out of your lane.
Yes.
So think chickpeas, lentils, different things, aubergines, cauliflower, just so many different flavors. Obviously not right in the beginning, but we bring them in. The more flavors, the better the eater. And I find over 1 year, they've got to be eating adult food. It's got to have more flavor. Otherwise, they also just like, no, I don't want the same thing. So,
Yeah.
yeah.
Right. Okay, perfect. Okay, let's talk about something really terrifying for moms, fevers. They're obviously quite a frequent issue sometimes for new moms. When do babies get them? And the most important thing, when is it serious? How do you know, like, okay, this is cut off, I need to actually go to a clinic or doctor now? And what treatments do you recommend?
So, I would say temperatures are common. So you might get a low grade temp with a tooth. You might get a temp when you've got a bit of hand, foot, and mouth, where you don't have to rush to the doctor. So the thing with a temp is if it's between 37.5 and say 38.5, manage that temp with some Panado or Nurofen or something like that for 48 hours. If you cannot break that temp or the rash hasn't come out, so with anything viral, whether it's hand, foot, and mouth, measles, chicken pox, anything, baby roseola, it's always going to start with a temp. As soon as the temp breaks, the rash comes out. So sometimes if you give it 48 hours, the temp will break and the rash will come out. And okay, now we know what we're dealing with here. If after 48 hours it hasn't broken, then I would say go check in with your ped. So that's the kind of thing I would deal with. Snotty noses,
Yes.
temps, like the little normal baby stuff. But if I'm worried, I will always refer to the ped. And if the baby's very young, like under 3 months old, we always refer to the ped. So manage it for 48 hours. and deal with the symptoms, whatever crops up. And if it doesn't, or if it's 39.5, 40, then I would just go straight to the doctor. Then it's
And
high.
what treatments would you know, if it's not too serious, I know using like a wet cloth is often quite
Like a tepid
good and
sponge. Yeah.
exactly.
So we can give meds. Normally we'll go straight into some paracetamol and stuff. If that's not
Mm,
really cutting it and you want to do something else, a tepid sponge means water that's not cold. So you don't want to
yes,
put them in cold
room
water. You don't want to
temperature.
shock them.
Mm,
Yeah. So you want to do a coolish water, but not, well, also not warm water.
freezing.
So, and the pits are where we try and put like a sponge or face cloth because that's going to bring the temp down. So you can put them in the bath or you can just give them a sponge of tepid temperature so that it will bring their temp down a little bit. Those are the two main things. Obviously, you're not going to cooler dress them, but you also don't want to put them in very cold environment because you want to shock them as well, you know. So just everything a bit cooler.
Perfect. Okay, so let's chat about the importance of a mom's wellness, her mental health and support structures. How does a clinic like fit in with all of this?
So I try and assess a mom without her really knowing that I'm assessing her.
That's good.
So,
Yeah.
and also we try and create an environment where I like to just chat to the moms. You know, I've become friends with.
Yes.
The other thing about your clinic is you with them for 2 years, you know, and then you might have another baby and start again. I've got some people on their fourth baby. So you're with someone for a very long time and you see them a lot. So I'm actually quite good friends with a lot of my mothers. And once you start really chatting to them, they open up. So you also need to have that sort of environment where moms are able to open up. But I'll always check that. I would say I automatically think you're going to be anxious with your first baby. So I'm already trying to like preempt that you are going to feel nervous and anxious and you're going to worry about weight and you're going to worry about feeding. It's normal. That's the normal passageway. But sometimes I'll have a mom who's very quiet, doesn't really want to talk. And I really encourage husbands as well, if I don't see it, to please send a message. So like send me a message if you're feeling like my wife is not right. I've had a few dads send me messages. So, and we have a huge referral system. Cape Town is very well supported. We have got great peds, great clinic sisters, great psychologists, psychiatrists. So there is a lot we can refer to, and we do. And what's the beauty of running a clinic with a lot of clients is that you have great psychologists bringing in their baby, great psychiatrists, you know, and peds and everyone. So we all already know who to go to when we need it. So
Amazing. Mm.
yeah, I always just look out for that surreptitiously, you know.
Yeah, because I think sometimes if it's obvious, then the mom will try and sort of hide it
Mm.
and like, oh no, I'm fine, I'm fine.
And then there's
Yeah.
also the normal anxiety, and that I can kind of gauge. Like, if she's just got the normal anxiety, as tough as it is, and I would say 80% of mothers have it because, I mean, what are we
Yes.
doing? You don't know what you're doing with your first baby. You know, is going to be anxious. So, and most of it's quite normal, but sometimes it's not. And then we need to
Yeah.
refer out. Yeah.
Especially if there's a lot of sleep deprivation and that's sustained, and then it's the two are
Sleep
just
deprivation
not.
will send you over the edge. It will literally
Yes, it
send you
will.
over the edge.
It
Yeah.
will. Yeah, absolutely. Okay, perfect. So we've gone through all of our questions so quickly. Um, the next two things, are there any upcoming events or do you have workshops or collabs or anything like that?
You know what? I don't have any set events, but I do interview a lot of people on different topics. So that
Yes.
always comes up every week or every
On your
second week
socials.
on my socials, on my Instagram. So there'll be a lot of interviews on specific topics with different people coming up. That's just going to be a given going through. And I try and keep things current on my socials so people can see what's
Yes.
happening. Yeah. So that's basically
Yes.
everything
Okay,
there.
perfect. And where is all of this happening? Mostly on Instagram.
All of it on Instagram. Baby Grow Clinic.
Okay, baby. So it's all on the Instagram, and you've got a website as well.
I got a
Are
website. They can book through the website if they want to, and under the contacts, my contact details are there. That people can just WhatsApp me. I don't mind. I'm very open on WhatsApp, so happy for them to do that if they need to, or email.
Okay,
Yeah.
perfect. That's amazing. And also, it's great that you've got all this educational content on, because I can see there's a lot here of very
Mm.
specific topics,
You know
and
what
that
I
is
try and
so
do?
helpful.
Yeah, I try and really ask the questions that a mom would want to ask. So that's what
Exactly.
I'm trying to like do in those interviews. When I have the pediatrician there, I want to ask him specific things that moms want to know, like, you know. And I often put question boxes up to the mom saying, "What do you want to know?" so that I
What do
can
you want to
ask
hear?
on your behalf,
You know,
down the
it's so good to have this, because sometimes I definitely found I either didn't have the terminology, or I didn't actually know where to start. I knew something was wrong in a very generalized area, but
room.
I had no clue how to even describe what was. And like you say, sometimes something will come up and you're watching and you're like, oh my gosh, that's it. That's exactly what,
What it
and it's
was,
just
yeah.
because of something you've seen. Yeah. Just
Mm.
so, so helpful.
Well, I think just as a parting note for people is find your right clinic sister, because that person will basically be able to help you in every department. And if she doesn't know, she's going to refer you on. So it's very important to have your home, your medical home away from home, so I can go there. I'll sometimes have moms going, I'll say, I don't need to see you next week. No, no, I'm coming next week. I go, okay, great. Just come in. Come in and hang out and feed
It's your
and weigh and
safety.
do. Yeah, sometimes you just need that.
You
So find
do.
that person for yourself, and then you have access to someone who can help you with everything. Yeah.
Absolutely. It's a security thing for a mom to have that connection, definitely. But thank
Mm.
you so much for today.
It's a
It's
pleasure.
been
It was
very
fun.
interesting.
Anytime.